Hey, what is going on? Welcome back. Dr. Delon Canterbury here, CEO, president, and founder of GeriatRx. I hope you guys are doing so well. I am back. Man, I am so refreshed. I had a beautiful vacation and spent the last couple of weeks just kind of taking the time to reflect and really just appreciate where the journey of geriatrics has taken me as a deprescribing advocate. But just in the first quarter, it's been an amazing year. Like I can't complain. Patients are happy, clients are getting results, and I'm just in a place of bliss. So really, I'm back. I'm in full swing. You'll see a couple videos, so prepare yourself. We're gonna talk more about the power we have to stop harmful medications in our seniors and really start deprescribing. So the theme of today is, sadly, how many seniors are going to have to die before we change our healthcare system to reimburse deprescribing? Like, how many patients have to unfortunately be put in harm's way until we literally start seeing, as an entire US health country, like as our health system, what can we do to literally change the way that we're providing care? Because we know that, bro, it ain't working. It's not working. We got disparities. We've got a lack of using pharmacists at the top of their license. We have meds left and right that are basically Me Too drugs that are ineffective. And honestly, I'm fed up. I'm a little fed up. I'm tired of hearing the same story with my caregivers and my patients and my loved ones who have to deal with battling against a system that has most of the odds against them to get better. And I'm like, it shouldn't be this hard to prevent harm in a vulnerable population. It shouldn't be this hard. It just should not be. I mean, how many times do I have to go over new data and present how many more seniors are dying in long-term care facilities or have chronic pain or are suffering from polypharmacy or over-medicating left and right? I mean, how many patients have to die? I'm not trying to be dark. I'm in a good mood, don't get me wrong, but it gets a little old seeing the numbers and seeing the burgeoning trend towards this growing gap in care. I mean, we have less and less senior care providers. We have less and less geriatricians. We have less people trained in the senior care space. And yet we're relying more and more and more and more on the meds to dictate the outcomes and their safety and hopefully their quality of life improves with this. And it doesn't always work that way, right? Like it just doesn't. And so we need to leverage our pharmacists. We need to integrate them more and incentivize the amount of value that we consistently bring to the table in our health system, in the hospital, outside the hospital, in the community setting, in retail, wherever. We got to find a different way to reduce overprescribing in this country, guys. So there's just no other way around it. There's no like, apart from, of course, money and incentivizing and trying to monetize it, like, we cannot expect to throw a bunch of meds at the problem and expect that to fix everything. That's not healthcare. That's hoping. That's a dream. That's I hope to God that works. We're not even talking about the social barriers yet. We're not even talking about the true determinants of what leads to better outcomes in our care. And so, I'm gonna say till the cows come home, but deprescribing is literally the future. It is literally the crutch of value-based care. It is like the beginning of value-based care, I feel. And everyone who touches a senior patient has as much responsibility and I feel as a role in advocating if they may see a medication or notice a side effect or symptom or sudden change that can lead to more harm. So why aren't we using more of this interdisciplinary team-based model to really start honing into deprescribing opportunities? Guys, I swear to you, it's not rocket science. Deprescribing needs to be required in our healthcare system. It needs to be integrated into each step of the healthcare model. I don't care if you're going to rehab or speech therapy, and then you're going to a psychologist after. Everyone needs a pharmacist. Everyone needs a better understanding of what the hell these medications are doing in their loved ones' bodies. So we must change the way we're delivering care if we expect things to change. Like, how can we do the same thing and assume it's going to get better? Guys, we spend the most money in a developed country on healthcare and still get some of the lowest benefits from it, which is problematic. So we have to change the narrative. We have to change our medication mindset. We have to get back to serving our patients holistically. Man, am I asking too much? Am I asking too much to help others see that they can literally stop medications by asking a couple questions? Yeah, it helps. I'm a pharmacist, but I end up teaching a little bit of what I do or what I would ask if it were my loved one. And I just tell my patients to do the same thing. Is your loved one on more than 5 medications? Yes? Okay, let's start asking questions about which ones can we consider potentially stopping, or which ones are life-saving, which ones are vital, which ones are necessary, right? We do a great job of throwing a pill at something in this country and treating, but we don't do any type of job, I feel, at least not as much as I see outside of myself and my patients, in stopping the medications and knowing when to tailor things off safely and knowing when to taper and knowing when to really jump in an opportunity. And then we don't even try to monetize that. We don't even try to reimburse a provider for stopping 8 meds and potentially preventing maybe a kidney failure or something down the road. I mean, of course, you can't put a dollar amount on what didn't happen. However, the sooner we start showing how the integration of pharmacists, the use of leveraging non-farm strategies to get people to the best healthcare goals, I mean, that's a part of the game. But again, our system does not try to reimburse deprescribing, at least directly with billable services. I mean, maybe marginally with a med rec or something, or targeted intervention, but I'm saying to consistently reward practices that have less readmission rates, that consistently show reduction of harm or cost avoidance or lack of wasted resources, or sending your nurse to fix a patient that fell because of a medication that you prescribed before. It don't seem as rocket science to me when we just teach providers as well as patients to just ask questions. Just ask questions about the meds. What's the timeline for all these medications? Why is my loved one still on all these medications? What can I do to safely stop them with the supervision of my doctor? How can we reduce harm? What are some things I could do in my lifestyle to reduce the need for medications? Am I drinking enough water? Simple stuff, simple to me, but again, it's mind-blowing that in the past couple of weeks, I've served on a dementia panel. I've served on an aging and brain health symposium with the University of Minnesota. I've done talks for 2 caregiver conferences in the last 2-3 weeks, and it's the same story. I swear to you, it's the same story. It's the same, oh, so-and-so tried to put auntie on this med and they went downhill and we don't know what the hell happened. And then 6 months later, they decided to stop it and now she's better. Or I've got patients who are over medicated on death's door. They're sent to hospice. They finally stop all the drugs because that's what hospice does. And they're wondering why their patients are rebounding, that they're doing great. I don't know. What do you think? Like, pharmacists aren't here for people to stay on medications for the rest of their lives. We don't want that. We would never want that. Especially if I'm in the retail setting. I don't want you on these meds most of the time. I don't even want you here if I'm, to be honest with you, in retail, because I wasn't happy. But at the same time, this model isn't working. And we're assuming the onus on the patient to suddenly maneuver and figure all this stuff out. That is problematic. Political greed is definitely problematic. Us being one of 2 countries that only allows direct-to-consumer advertisement is problematic. It ain't like new, but why is that allowed? It's not as always as easy as capitalism rules the world. I jaded as it sounds, I kind of feel that way. But is there a better answer? Can someone give me a better answer? Does it have to always come down to the man and greed? I wish it wasn't. But the truth is, and what we show you in our deprescribing accelerator is that you can monetize deprescribing. You can leverage your expertise to get seniors off of harmful medications. And you don't have to be a doctor. Guys, you don't have to be a doctor. Majority of my cases, I'm asking the patients the same questions. How many meds are you on? What side effects are you having? And then I'm asking, what can we safely stop? It's most of the work I do. I mean, maybe I'm overplaying myself, but still, it's deprescribing starts with a dialogue, and it starts with trust. It starts with educating, and it starts with, again, trust. Patients trust their providers to make sure that they're on the best regimens, the best care. So it starts there. So why aren't we educating more and more and more and more of our clinicians who are writing for prescriptions and then expecting them to know everything about the drug when they're not even trained about the drug? That's what pharmacists are. That's what pharmacists do. Doesn't it make sense to have a drug expert know what you're going to write before you write the prescription, instead of writing the prescription and then hoping it's okay with the pharmacist later? Does that even sound right? Does that even sound right? It doesn't. It doesn't. It's wrong. I'm tired of it. I'm tired of how broken this system is, where we are consistently reactively trying to get people back without even looking at what they're doing at home, or the social barriers, or if they have a job, or if they even have access to care or transportation or a support system or a pharmacist in their back pocket to let them know if the meds are appropriate or not. I mean, I'm not a public health expert. I'm not. I just know what I see. And what I see and hear are people being put in harm's way from drugs, particularly in our seniors. Our seniors suffer, unfortunately, more drug sensitivity, then more drug interactions, more polypharmacy, there's prescribing cascade. There are tons of measures that lead up to this point. And yet, and still, we know 275,000 people are dying each year because of mismanaged medications. We know we spend over $500 billion each year on people that are mismanaged on their medications. So if we know the elephant in the room and it's exorbitant costs for healthcare, why aren't we addressing that? Bueller? Anyone? Why aren't we addressing that? So let's start with something simple. And that's what I'm trying to do. That's what I'm doing. That's what I'm teaching people like yourself, nurses, caregiver advocates, senior care providers, pharmacists, social workers. I want the whole damn healthcare interdisciplinary team learning how to deprescribe, learning how to advocate, learning how to teach people to have a different mindset. I'm talking PT, OT, ST, all of them are eligible to join our Deprescribing Accelerator. Why? This is what we morally have to do in this country. Yeah, this is morally what we have to do. This is what we have to do. This is just straight up. There's no way around it. And we definitely can monetize and leverage value-based care. This is the future of healthcare. It's not going away. And so we will show you how you can monetize it. You can use it. My God, where should we start? We could do it with educational seminars. We can do Deprescribing conferences, which, guess what? GeriatRx will be helping to host a Deprescribing conference this summer, so stay tuned. I'll share more details about how you can get involved with Deprescribing. But it starts with a dialogue. It starts with having someone who just knows how to ask the right questions. I've given away consults for free where I literally say 3 things and patients were able to see results from getting their mom off of a couple meds just by asking, hey, what can we stop? I'm not going to say every doctor will stop everything or be cool with it. I'm simply saying people don't even think to ask that they can get off and take care of their own meds, their own body. I mean, ultimately, the patient is the CEO of their care. I say it all the time. So we need to re-emphasize and re-educate and not underestimate the power of the patient who cares about their loved one, who wants to get the best out of their life, their quality of life, right? We can't underestimate that. So we need to put the power back into the people. We need to use our pharmacists. We need to leverage them. We need to be integrated seamlessly into our system. We need to put value-based care at the forefront of all of this. We need to incentivize people that are providing care and not having their patients go back to the hospital. I don't have all the answers. I am not a public health expert. I am a pharmacist who believes that our seniors are the most vulnerable population who suffer time and time again from the most drug interactions. And I am fed up in that I feel I'm the only one talking about stopping harmful medications in seniors. I'm fed up. And I mean, and I'm grateful because now I'm doing what I love and I can help support people to advocate more for their loved ones. But what my passion lies is showing those that you can do the same thing. You can do the very same thing. You can do the very same thing, and you can use this as a way to expand upon your practice and learn how to leverage, again, your pharmacist. So, how many clinical trials do I have to read? How many reports? How many white papers? How many just reams of data do I have to sift through and keep seeing the answer that's there, which is we have a problem. We have a problem. Guess what? We have a problem. We have all these things, and we have a growing Medicare population that continues to cripple under its own system. We can barely afford it. Patients can't even afford Medicare. I repeat, patients cannot even afford Medicare. Does anyone else see the problem here? If your patients can't even afford the meds, let alone the care they're getting, how can you really expect them to be getting the best quality of their life and being the CEO of their health and getting all the things they need to thrive and age gracefully and independently? So, this is meant to disrupt your day. This post is meant to piss you off. This post is not meant to be nice. It's not meant to play patty cake with you. It's meant to show you that we have a duty as healthcare professionals to reduce harm. So we need to enact policies and procedures and reimburse people who reduce harm. That's it. That's it. I'm tired of this fee-for-service crap. I'm tired of billing people for meds that are ineffective. I'm tired of signing off on scripts that kill my patients. I'm not against meds. Don't get me wrong. I think meds are great. I am against assuming that all meds are safe, and I am against us just bastardizing what pharmacists do. And what we do is save lives by deprescribing, by pharmacogenomics, by precision medicine, by value-based care, by providing cost-saving alternatives, by speaking up for patients, by working as a team with the doctors and the caregivers. It shouldn't be a silo. So I'm tired of it. And there are ways that you can make that switch today. I want to show you how our Deprescribing Accelerator does this. We not only teach you how you can spot some of those signs of over-medicating in seniors, but how you can leverage and monetize deprescribing, the safe removal of harmful meds. I don't care if you're a pharmacist, nurse, medical provider, PA. The truth is, we are not doing enough to reduce harm. So instead of just adding more drugs to the mix, let's start with the problem we got first. And that's, let's at least get them off of some stuff. Then let's, deep dive into some of the other social barriers. I mean, it's all important. Don't get me wrong. But there doesn't need to be another 80-year-old woman I meet in this world who's on over 20 plus meds, who can barely tell you where she is, and everything on her medication profile is just considered to be okay. No! Okay? No. That's not right. That's not a way to live. That's not how I want my grandma to live. I started this company literally because my grandmother was prescribed an inappropriate antipsychotic while she was in a nursing home, which spiraled her dementia out of control, forced my parents to take her back in. And it wasn't until a pharmacist stood up and advocated and said, hey, this is wrong, 5-6 months later, and that's when she finally got better. Like, a prescriber wrote the prescription in the nursing home, which subsequently kicked her out of the nursing home because her symptoms worsened because of the drug they wrote. Because of the drug they wrote. So yeah, I am angry. I'm also happy, generally, but I'm angry because this is what the battle we face as patients and providers. And there has to be a change in our mindset. There has to be a change in the way we do business. It ain't working, bro. The pandemic has shown enough of how we barely are. We're not even maintaining mental health in this country right now. So you think our seniors are just fine? They're just cool in isolation and their mental health is great? That includes them too. So they're suffering too. We got to change this, man. So if your loved one's on 5 or more meds, if your loved one is suddenly fatigued or confused, or you're finding clients or patients who you're just struggling with all these meds, and all you can say is, well, ask your doctor, then we got to do a damn better job in this country to reduce overprescribing. And we will. And if it's, I will. I don't care if I'm doing it alone. We got to change this. And again, I ask, what's it going to take for us to incentivize and fund deprescribing nationally, internationally, and make this the mainstay of care? In the interim, if you don't want to wait 50 years for Congress to make up their mind, join our accelerator. I will at least show you all I've learned and all we can do now to hopefully get your business off the ground, to hopefully add a value-added service, to save more of these lives, to give you tools at your fingertips that you can use to advocate and deprescribe, and by the grace of God, get people off these harmful medications. So my TED Talk is over. I would love to know your thoughts. There's been a great dialogue today. But there are many issues that lead up to these problems, guys. There's a prescribing cascade. Of course, I've mentioned social barriers to care. There's clinical inertia. There's language barriers, there's cultural discrepancies. I mean, there's motivation, like interviewing that needs to be done, and in terms of training people to see eye to eye where their patients are. So there are ways we can literally stop harmful medications. Why the hell aren't we using the tools consistently to get it done? And I'm not trying to blame the doctor or blame the nurse. I blame the system. It's extremely difficult to do all this with our current system. If you have infinite money and a small population, you can do whatever the hell you want, and I'm sure you'll make those numbers look pretty. I guarantee it. With enough cash flow and incentivizing and care, it can be done. We just choose not to. And if I'm looking at data in other countries with less resources and less time, and they're doing it better than us, we got problems. That's why I am the chief deprescriber of the Deprescribing Accelerator. I'm tired of us thinking that it's safe to live in this matrix of healthcare and choose the blue pill of the status quo. The status quo is killing us. So choose the red pill, join our Deprescribing Accelerator, learn how you can start saving lives and making some money, growing your business, but hopefully finding that passion back that I lost in healthcare when I first started as a pharmacist. So much love. I haven't been live in a while, so I kind of came with the extra ammo today, but I got a lot of love and I got a lot more awesome content coming up in the next few weeks where we'll share more about our Deprescribing program. We'll talk more about the results, the action, the cool stuff you get out of this program, and share ways, again, how you can best advocate. So you guys be well, be safe. Much love, and I'll see y'all next time. Take it easy.